Welcome to another episode of MedSynapse podcast series. I'm Hetvi Shah, your host, and this is the third episode in our ongoing series with National Cancer Society of Malaysia. Cancer is often thought of as a physical battle, but the emotional and psychological impact can be just as challenging. And today we are shining a light on this crucial aspect with someone who has dedicated his career to supporting cancer patients' mental well being, Mr. Jefferson. A clinical psychologist and passionate advocate for psycho-oncology, his journey began as a caregiver, which fueled his commitment to integrating mental health support into oncology. From establishing psycho-oncology clinics in hospitals to researching complementary therapies, he's been working to make psychological care an integral part of cancer treatment. So, Jefferson, welcome to the podcast, and such a pleasure to have you with us today.
Thank you so much, Miss Happy, for having me as well. And for those who are listening to MedSynapse, hi everyone, good morning, good afternoon, good evening, wherever you are in the world right now. Right, so I'm just so glad that we invited to share about one of the very profound components in cancer care, which is mental health. As much as we think that it's such an important component, right, but it's also something that is often being forgotten, that when it comes to cancer care, people want to get away of the cancer, wants to get a cure for cancer, but mental health itself is such a profound thing to be discussed. And today is a time where we actually bring it up for everyone to talk about it.
Yeah, actually, you're so right, and that is why this conversation is also very important. Jefferson, to start with, cancer is not just a physical battle, it's an
Hmm.
emotional and mental one too. So, from your experience, how does a cancer diagnosis typically impact a patient's mental health, and what are the most common psychological challenges they face?
Right. Miss Abby, I love that how you open up this question by saying that it's not just a physical battle, it's also an emotional one, which is very true because cancer itself, when we first think of cancer, what we will think of? We think of fear, think of death, and all this would stir up so much of our emotional feelings, and it will cause a profound emotional shift, right? So when a person first got to know about cancer, right, that they got diagnosed with cancer, right? The most common reaction, I would always say that it's grief, right? Because when it comes to cancer, right, it's not just a disease, right? It signifies something, which is signify loss, right? It signifies a loss of their health, where previously they were healthy and then now they have to carry this label as a cancer patient, right? They are sick at this moment. So they have lost the status of, they lost their health, right? Loss of time, loss of their identity. Right? Previously, they're healthy. Previously, this person is a father, a husband, but now he's carrying that identity, that role as a sick patient. Right? The loss of self control. Right? They can't even control what is going to happen tomorrow. Right? They can't even know what this treatment is going to be, or what this treatment is going to cost them. Is there any side effects? Nobody's going to know. And with that unknown, right, you just have this sense of loss of this self-control. Last time, previously, everything was in their control, right? They can manipulate everything. And now with cancer, everything's just, I don't know what's next. Right? And lastly, it's also the loss of life content. Previously, they have their whole life plan ahead of them. They plan their retirement, they want to travel the world. But when they got retirement and then they have this cancer as well, it just comes along with it. Then everything just changed, right? And everything I just lost us once again. Right? So I always say that when it comes to cancer diagnosis, it's really about losses. And when there's losses, there's grief. Right? And grief response caters so much, right? From feeling sad, feeling angry, feeling resentment, or feeling depressed that, hey, why is it happening to me? I was a person who was healthy, I take care of my health, I exercise every single day, I don't smoke, I don't drink, and now cancer just struck me. Have I done anything wrong? Right? So you can see, right, in just one word, cancer itself, right, causes so much of emotion, so much of discussion, so much of topics that can actually talk about. And therefore, emotional, component in cancer is so, so important to be discussed. Right? And if Hefty, you're asking me what are the most common psychological challenges, I would say grief itself is the most common challenge itself, right? And not just grief, we also talked about fears, talk about sadness, talked about them feeling not good enough or they didn't do good enough, right? So all these things again are being all stirred up inside of them. But again, I would say that has all this been addressed by someone, right? When you go to a consultation room with the doctors, the doctors actually ask, right? So you just got the news of stage 4 cancer, for example, right? How are you feeling? Do you need someone to talk to? Is there a doctor that would do this? Maybe there is, but how many of them will actually do it, right? So most of the time they'll just go straight into, okay, so tomorrow you need to draw some blood samples, we'll go through some scans, right? Let's do some markings on your radiotherapy treatment. Let's start treatment immediately, right? And treatment itself is another scary thing for patients, right? Because we always hear about how scary chemotherapy is, right? The amount of suffering, the amount of pain that associated with chemotherapy. Of course, people will associate this treatment as something scary. And when we just talked about treatment, right, they don't even have time to process the diagnosis, be the fear that accompanies them when we talk about treatment, right? So I also always say that the mental health component in cancer, right, is often being overshadowed by the tendency to seek treatment, the tendency to seek a cure for cancer. And therefore, I would say grief in cancer, right, is always being described as an eclipse grief, right? Eclipse being shadowed by what? Being shadowed by the need for medical treatment, right? And what is shadowing it is the emotional component behind that diagnosis, behind that consultation, behind that 15 minutes consultation, right? And all these things are all being hidden inside. If not hidden, they are being suppressed because people don't give them the space to actually explore, express all of them, right? If I'm to put things into perspective, right, in the Malaysian context, 4 out of 5 cancer patients actually did not receive any form of emotional support, which is very, very concerning, right? And with them not receiving this kind of support, right, 2 out of 5 would actually have pathological grief, meaning their grief response was so intense that it affected their functioning. They are not doing things that they previously are doing, right? They're not going out. They're not living the life despite having cancer. And this is what grief can cause to a person if their grief response were not being explored, not being even touched or asked by someone.
Yeah, I
So
think
these
that
are
makes
really the
so much
common.
sense.
These are the challenges everyone is
Yeah.
facing, every cancer patient.
And I think it's not just about the illness itself, it comes with everything it comes with. Like you mentioned about grief, that's also so important to address. Expressing their feelings is also something
Mm.
that they actually need. It's really interesting to know.
Yep.
So, so that actually brings me to the next question.
Mm.
So, how well is the mental health integrated into cancer care in Malaysia? And are we doing enough, or is there more that needs to be done?
Right. I love this question, Hefty, because as a person who is trying to advocate for psycho-oncology in the Malaysian setting, right, I would say that while there is good progress in Malaysia, right, because it's starting to pick up, but I would still say that these efforts, right, are remain inconsistent throughout the whole Malaysian context, right? Some hospitals actually have the resources, right, the facilities for psycho-oncology services, but some still lacking in a more structured psychological support system, right? Mainly it's because that the lack of the human resources, right, and the lack of available facilities in the healthcare settings, right? Because in the Malaysian context, right, it's our healthcare system is very centralized in our capital city in Malaysia, which is Kuala Lumpur, right, and also some major cities, right? When all these services are being centralized in one place, right, every service wants to go into the hospital, right? And then the hospital has to cater to all the services, right? And same goes to oncology. So when they have to cater for so many people, obviously they don't have a space to make space to squeeze in a little bit space for mental health because they want to talk about it, right? Some hospitals, which is good enough, right? Some small hospitals that I actually visited, right? They have social workers, they have volunteers coming in to provide some form of support, right? They actually speak to the patient, they take some time to sit with them. But I would say that these support are far beyond the competencies and the skills of the social workers and volunteers, right? Are they equipped with the skills to actually understand and go through those emotional turmoil of cancer patient, right? And I also encountered some nurses who actually were kind enough to take up the role as a counselor when they're going through wards, when they're in the clinic, right? They actually provide a listening ear and empathetic care. But I was keep on thinking that, hey, these nurses are already overwhelmed with their role as a nurse, and yet they have to take on this hat. They have to put on this hat as a counselor. Same goes to some doctors, they actually put on this hat as well, which is amazing. But you see, I'm just thinking that how overwhelmed are they to actually take on this? Right? And I believe that the Malaysian healthcare system has to actually understand that we need to integrate a more structured form of psychological care into oncology care itself.
Yeah, I think that's such an important point to be addressed. And I think mental well-being is like something that should be a part of treatment from the beginning also.
Absolutely. It should be part of the treatment itself.
Yeah.
Because when it comes to psychology, we talked about the biopsychosocial and spiritual care model, right? So other than talking about the biological side of things, we have to talk about social, talk about psychological, and just recently we talked about spiritual components in it. So the care in cancer, right, should be a more holistic one, not just on medical side
Yeah.
only.
That's so beautifully said that it should be a holistic approach only. Now, doctor, speaking of support for mental health, family, caregivers, and community play a huge role in cancer patients' journey. So, what are some of the most effective coping strategies that you've seen to help patients?
Right. I believe Miss Hefley, you're asking all the right questions for today. Because again, right, in Malaysian context, we are very what's it called? We cater, we treasure family connections a lot or social connections a lot, right? So when someone get diagnosed with cancer, right, we can suddenly realize that all the family members start to come together, the friends and family all come together to try to understand that, right? With that, I think it's a good thing. People start to come together to understand you better. But I keep on thinking that, hey, it can be a harm to the patient as well because everyone wants to give an input to the patient, right? Everyone wants to be the doctor in the household. Everyone wants to say, hey, you shouldn't do this. I know a doctor. Let's go to that doctor. I know this treatment is better. Let's go to this treatment. I know eating this food is better. It can cure cancer. Why don't you start eating it, right? So when all people are coming together, right, it can actually cause some form of pressure, right, to the cancer patient because they are still processing all these things inside of them, and people still give them so much of information, right? So what if
Misconceptions also spread a lot.
exactly. There are different biases, different perception of what care is. It's going to cause a lot of pressure to the patient, right? So what is the most effective way is actually to uphold the word support literally, right? So when it comes to the word support, right, it's not just being, offering word of encouragement, being there for you, giving you so much of information on new treatment modalities, right? It's actually being emotionally present for the patient, right? Be there, whenever they need someone to cry on, when they need someone to help them with some chores, be there for them. Just the mere accompaniment for them is good enough. Because if you can recall just now when I mentioned, cancer is a loss of time. So when they know that their days on earth is being numbered, they will treasure as much time they can have with the people who they love most. Right? So being an accompaniment, being there with them, just sit there, talk about days, right? If they are watching TV, talk about the TV show, this is so much more important, so much more meaningful for a cancer patient, more meaningful than giving so much information. Unless the cancer patient actually asks for this information, then we can give, right? Because they actually share their needs when it comes to cancer support. Right? In that case, then we can actually give them the information. If they did not actually ask, we try to refrain ourselves from giving so much information. But instead, we can actually ask them, I know about this doctor, who has some previous cases who have cured certain kind of cancer. Would you want me to recommend this doctor for you? Right. So ask the question back to them. Give the patient the autonomy to answer the question rather than throwing everything to them, right? It's going to be very, very difficult for them, right? Put our personal agenda aside. As much as we want to care for the patient, I understand it because me, myself, I was a caregiver to my mom as well. I wanted to provide the most care for my mom, right? But then I think of, those are my needs to provide care for my mom. But is that what my mom really needs? Was that what my mom wanted me during that time? So with that thought, I changed my perception. I changed my approach in providing care. I should ask my mom, so what did you want me to do for you? What can I do better for you? Right? Again, we give the autonomy back to the patient, back to them to allow them to express their needs. Right? Put aside our agenda, put aside our own judgment. If you think that the patient shouldn't do this, right? We should put aside first, try to listen to them. If they say they want to travel the world before, they don't want to do any treatment, they want to travel the world, right? Understand that, okay, I see that you want to get the most of experience before death itself, right? But what if you can do more with treatment? So use this way to help them to understand what their needs better.
So, doctors and healthcare providers are on the front lines of patient care. So, how can they be better equipped to recognize and address mental health concerns in cancer patients?
Yeah, at the front end because they are the first person who meet the patients,
Mm.
right? Whenever they break the bad news or they have to follow up with them in a more in a timely manner, lah, right? So what they can do is actually attend more trainings, right? Attend more trainings not just on their medical side of things, right? But on mental health, right? We have this thing called mental health psychological first aid. So I would encourage all mental healthcare providers to actually get some ideas on what psychological first aid is, right? Because first aid, right, is not an intervention. It's more of a support for those who requires a more acute intervention, like in a way, right? Okay, so with a first aid, right, it can actually help to identify them, right? There are multiple courses online or even courses offered by multiple organizations in Malaysia, right? Just go for one of the courses to understand what are the main things that should be addressed when you actually identify a patient who has some form of mental health concerns, right? So not just doctors have to attend trainings. Hospital settings can also develop training modules for their doctors, right? Like how in NCSA, with National Cancer Society, we often conduct training modules, advocacy work, so that more healthcare professionals can actually identify, help to equip those skills to identify these skills, right? To understand that, hey, when a patient has these symptoms, have these fears, right? What can they do? Mm-mm. So a lot of times, right, doctors, I'm very sorry if doctors are here, right? I'm very sorry that some doctors, they may think that a patient who has these symptoms, right, they will label them as a difficult patient, right? Why a difficult patient? Mainly because their emotional responses were too intense, right? They are not following the doctor's treatment plan, right? They are so afraid to go to start chemotherapy, they actually don't want to start. So when the patient does not want to adhere to their treatment, the doctors would get frustrated. Would get to question why this patient doesn't want to follow, right? So we will label them as difficult patient, right? So I would love a healthcare professional to actually relabel patient, right? Don't see them as a difficult patient. Every difficult patient has a sense of vulnerability inside them. What they need, right, is not some magical thinking, right? What they need is just a validation from healthcare professionals. They need reassurance from doctors to say that, hey, it's okay. I know that you're afraid of chemotherapy. I'll be here together with you, right? Nurses will be here with you. I can refer you to a psychologist to be there with you. Let's go through this together. That is what the patient wants to hear, right? And we have to be equipped with that skill, with that not just skill. Sometimes I feel that it's not really skill, but that passionate heart, to be able to to reflect back to our patient. If we don't have that passion, our patients can sense that, right? They will see that inside of us, and they will actually feel that also. So other than skill, you need to have this humanistic personality inside of you as well.
Mm,
Skill is just a
yeah,
hard skill, right? You have to have soft skills, how to communicate with your patients, how to initiate those conversations. As much as they are difficult conversations, we
mm,
have to initiate that.
absolutely. I think training is key, obviously, but then soft skills is a necessity when addressing such
Mm.
concerns. Also, that's
Yep, yes, and these both
very
have to come
beautifully said.
together. Right?
Correct.
You can attend 100 conferences, 100 trainings, but if you don't have those soft skills, those
Correct.
trainings would be just, I wouldn't say meaningless, but not
Mm.
being equipped in a proper way.
And
Mm.
actually, for patients also who are actually going through so much, they would also want somebody who is soft spoken and who can address their issues very well. So that is also
Yes,
important.
exactly. Patients rely a lot on healthcare professionals, and we
Yes,
have to be that person for them to rely on.
right.
We have to adopt this role from now on. Put on this hat
Yeah,
some more.
absolutely. That's a good message, I think.
Mm, mm.
Now, Jefferson, finally, there's so much stigma still there surrounding, mental health, especially in cancer care. So, how can organizations like, National Cancer Society of Malaysia and platforms like MedSynapse help actually change that?
Yep. So when it comes to stigma, right, we always have this term called breaking the stigma, right?
Yeah.
But I keep on thinking that, right, often I think we are trying too hard to so-called break the stigma, to which I feel like it's a bit impossible to break the stigma because stigma will forever be in the society.
Mm,
As much as we so-called break one stigma already, there'll still be under another one coming in, right? So rather, right, in NCSL, what we do, at least in my team, mental health department, right, what we do is we actually work around the stigma and try to understand what's the reason behind the stigma, right? Is it being motivated by fear? Is it that because people are so afraid of cancer, therefore they label cancer as something scary, right? Or is it being motivated by their own personal agenda? Therefore, they are so reluctant to talk about mental health and cancer, right? So by shifting this narrative, shifting that we try to break the stigma, let's work around it, right? We can actually advocate that cancer patients can be strong and functioning individuals, right? As much as we label them as cancer patient, I've been using the word patient, right? But sometimes we have to remember that they are individuals, right? They used to be people who are functional, right? They used to be someone who is strong and able to contribute to the society. And just because they are cancer patient, they can't do that anymore, right? I don't think so, right? So like how, if you're asking how can we use this platform to actually um, break this stigma, right? Is actually to advocate for the strength and the abilities of this cancer patient, right? Make make them understand themselves that they have to empower themselves as well, right? Cancer patients should not label themselves as patients anymore. I always say to my clients or my patient that they should not always carry themselves as a patient or a survivor. They should advocate themselves as a strong and functional human being. They are a human being. They have all those ability to live their life in a more meaningful way. But how in NCSM, our motto is giving hope and celebrating life. Right? With that, right, I just feel that mental health support is not just focusing on the weakness. Right? There's no one is actually weak when they have mental health issues or mental health concerns, right? They are just part of life, part of cancer itself. It's cancer that's causing them to feel all this, right? So rather than labeling them as somewhat of a sick person, right, or a patient, right, it's time to actually empower them to live their life in a more meaningful way, despite going through cancer.
Yeah, actually, that's so rightly said. And I think addressing those is really, really important. I think
Mhm,
addressing the
mhm.
needs of the patients is really important.
Yep. And I think MedSynapse has done a very great job to invite.
So is
Right,
the
right.
MCSM.
Right. I love that you guys incorporate so much of different topics into this whole series is inside. Not just talking about medical, I think everyone can get so much
Yeah.
of information on that already. But we have to put in so many different components into discussions of cancer care.
Mm.
Mm,
Yeah, I think that's such a holistic cancer in itself is a holistic approach that needs to be addressed in each way also. So it's really important.
Yep. I think
Yeah.
mental health itself people always say that mental health is such an expensive thing to go through because seeing a
Yeah.
therapist, right, is going to cost a lot. Going to a psychiatrist is going to cost a lot. People often associate mental health as the rich people illness. Same goes to cancer. They think that rich people only get cancer, right? Mental health, only rich people can afford to cope with it. But I think that, hey, we shouldn't put that as well. We should always label mental health as a necessity.
Necessity, correct.
Right, right. It shouldn't be a luxury. It should be a necessity.
And it's
Everyone
so necessary
deserves
to
that.
actually address mental health. It's very important these days, I think.
Exactly. Right.
Yeah. So as we wrap up today's session, thank you so much for sharing your insights on this crucial aspect of cancer care. So this has been such an insightful conversation, Jefferson. So thank you so much.
No worries, Happy. And thank you so much for allowing me to share my thoughts, try to advocate as much as I can in the cancer care setting as well.
Yeah, I think your work is actually truly making a difference in cancer care also.
Yes, I believe
And
one person is not enough. We need more people on
yeah,
board on this whole process lah, to achieve
correct.
change.
And you need to start somewhere, and I think you're starting it, so it's really interesting to know that.
Yes, yes, yes.
And to our listeners, if you found this discussion valuable, share it with others as well. And stay tuned for more episodes in our series with National Cancer Society of Malaysia. And until next time, take care and prioritize your health.